Hello, everybody. We are talking about dry needling today. So this is actually, I think, one of our first or second videos for dry needling. We have tons of questions about this all the time. I am Molly from Breathe Physical Therapy and Wellness, and I'm here with Darcy from Burn Boot Camp, one of our favorite things, favorite places for our moms to work out. Tell us what you got going on at Burn Boot Camp lately.
Yeah, so right now we have a ton of women in the gym. It's super energy, super exciting. And we always have a free 2-week test drive where you come in, try us out for free for a full 2 weeks with unlimited camps, childcare, and the best we have to offer. So that is what we have going on.
And it's a great workout. I did it once, and I only did 15 minutes because my children were screaming in the childcare room, and I was super sore, and it felt so great. But today, we are hoping, this is Debbie. If you have come to Breathe before, this is Debbie from our front desk. And we are going to do some dry needling on her. But Darcy, you said that you're the women that are coming have a couple questions.
Yeah.
So we're going to kind of go through some questions, and then we'll go through an example on Debbie.
Yeah. So it's kind of a combination, honestly, between their questions and my questions, because I've been curious about this for a while.
Mm-hmm.
So, you know, if you don't know, I'm an ER nurse. And so I have heard of trigger point injections and things like that for tension, headaches, and stuff like that in the past. Can you tell me what is the difference or similarities and what are they used for?
Yes. So it's called dry needling because it's just a needle. It's a super thin needle, and there's nothing. I'm not injecting you with anything. Okay. So that's why it's called dry and how it's different. And trigger point injections, they're taking whatever medicine that they've determined. They go in the muscle and just inject, and then they're done. With dry needling, I find the same tight muscle in a top band or a muscle knot, and then I move the needle in a way in the muscle so that the muscle twitches, and every time you get a twitch, that muscle melts away. Okay. So different people have different success with each thing, of course. There's been one research study that showed that there was no difference in improvement between trigger point injection and just dry needling, which is pretty amazing. Of just the presence of the needle was able to release the muscle so that you didn't need the medication. But then there's a lot of people who found relief with the injections as well. But
awesome. Yeah. Okay. And before I forget this, all of you guys who have struggled with tension headaches and like muscle problems and all that, you know, normally people say, give me a like, give me a thumbs up. We're going to go with the frown face, like the frown, the angry face. Like, give us the, because nobody likes having all the tension, preventing you from getting your workouts in, from just being like comfortable.
Right.
So
to be able to sit. We do this a lot for like butt pain. People think they have sciatica. So you can give an angry face if you have had that before. And then the more angry faces or likes or loves that we get, then the more people will see it, and we'll spread the word about treatment that can be done for all those things. But yes,
that was one of my questions. So, I mean, I'm familiar. I have a friend that swears by it. Super fit, does tons of upper body work, pull-ups, and it's her trap. You know, so that's kind of
the trap.
The only thing. That's the one that I'm like really familiar with. But I'm assuming there are other things, like you just mentioned sciatica, which
So we can needle nearly. There's some exceptions, but we can needle nearly every muscle in the body. So we also treat TMJ or tension headaches. I can needle muscles in your head and your facial muscles, all the muscles down to into your hand, wrist, toes. That doesn't feel the greatest, but it works really well for plantar fasciitis or just foot pain.
Really?
Calves, like those tight calves that just like I stretch and it doesn't get released. So really there's a few exceptions, like your hip flexor we can do. A lot of people always like bang on your hip flexor and you're always digging on it, you don't get anywhere. It's really effective for that too.
So what does a typical treatment, like, is it multiple treatments, or like what does the protocol normally look like?
Right, it totally depends on the person, of course, just like everything, right? So the first time that you would come in for an appointment, we do a full assessment. So I tell people, like, this is just not a silver bullet, like, gonna fix all your things. So we do the assessment, see how you're moving, see how your strength is, see how your flexibility is. And then if we find that it's the tight muscles that are causing the problem, then we treat it. And then we teach you how to move again so it doesn't come back. Maybe you have to do some targeted strengthening. Sometimes it's just learning to relax, especially if it's constantly upper traps, especially with women and mothers. Like this all the time, right? So relearning how to be down.
Me feel like I need to
straighten up faster. Yes. Relaxing there. and just learning how to move again, strengthen flexibility. So it just depends. Sometimes we do a muscle and that person's like, it's been good for a year and I've learned how to move and I'm doing the exercises that I showed them and I don't have to do it again. But if we release the upper trap and let's say you go back to work and you're on your computer and you're like this all day, it's probably going to come back, and then we reassess and do things over again. But there's sometimes again, it's not a silver bullet, but we can release the muscle and teach you how to do it, how to relax, and then you're good. Okay. Another way of looking at it is sometimes people come in and you just feel like you have so much tension, like you can't get into good posture. You can't do things because you feel like the weight of your muscles and your body on you. And then once that released, then they can do mobility and they can do other things that they weren't able to do without having to fight against their body so much, which is awesome. So then those people make progress really fast.
So how does this fit in, like, if somebody has, like, an acute injury? So say, you know, like, you talked about, like, plantar fasciitis. So say it's really, really bothering me. Should I come in now or should I wait? Or what does that look like?
We always want you to come in now, just so that we can get you assessed and then we can give you the things to work on so it doesn't snowball. The worst thing is people are like, well, it started 3 months ago and now I'm here and now I'm compensating and now my left hip hurts because my right foot hurt and all those kind of things. So we always want you to come in right away. And then it will just depend. So if it's an acute injury, like a muscle strain, we don't do it in any active bleeding. So if you had a bruise, things like that, we would never needle there, but we can teach you how to protect, let it heal, and check out other areas. Like maybe if you pull your quad or your hamstring, it could be mobility issue in your hip, like your glute muscles are super tight or your piriformis, and that's what caused that. So we can kind of work in different areas to make you feel better. We might just not be able to stick it right in that spot. So
makes sense.
Just depends.
Yeah. Okay.
Do you have any other questions? No, so pricing wise, right? So it's just like a service that we use with anything else. So it's just a treatment. So our we are in network with Blue Cross. We don't specifically bill for dry needling. It's like a 20-second deal, and then we bill for the rest of the service, all the other educational pieces, all the other hands-on stuff that we're doing, maybe some manual work like massage afterwards, and the exercises. So all of that can go through Blue Cross. We also have a self-pay rate if you're not with Blue Cross. It's $175 is your initial eval, and that's a whole hour. And again, we go through everything so that you get the results that you want, and then you don't have to keep coming back over and over. And then your follow-up visits after the initial are $100. And again, that's 45-minute sessions. The dry needling can be included in that. And then we just kind of tease apart all the rest of the problems that you're having to keep it from coming back. Again, we want long-term solutions, not just a quick fix. So
I would have to say, like, personally, like from a nursing perspective, that's something that I just really like struck a chord with me is like the amount of prevention and education that you guys do, that it's not something that it's a quick pill, quick fix, things like that, that you really look at the whole body and long-term solutions. So like, and
giving you the pieces, like giving you things that you can do on your own, just so that you don't feel like you have to keep coming back to us, that you'll be like, okay, this is the problems that I know that they've identified. This, when I start feeling that creeping up, I know what to do to nip it so that I don't have to keep making time for appointments and all that. Yeah. So you're empowered so that you know what to do, and then if you can't get it on your own, then come back and see us.
You get the skills.
Right.
That's great.
So I'll mention to your audience the other things that we do. We do all women's orthopedic pelvic health. So if you are peeing your pants, cough, sneeze, laugh, jump, lifting weights, we can help you with that. If you're having back pain, neck pain, headaches, we will fix all of the things. That's what we want to do. We'll help all of the women with all of the things.
Yes.
Right.
Yes.
So if Debbie, are you ready? You've been laying here. Yeah. Are you asleep? Okay. So with Debbie, I'm familiar with her. So we've already done an assessment. She has a shoulder injury that bothers her. She's at our front desk and on the phone a lot. So I've seen her move. I've seen where she needs to strengthen, all the things. She has a tight muscle in here. So this is upper trap. That's very, very common for people to need work on. So we're going to treat that. I'll let you hold one of these. So you can show them the needle while I'm gloving up. How about that? So you can just show them it's teeny, teeny, teeny.
Oh gosh, I feel like I kind of need like old lady glasses for this. It is teeny teeny. So I don't know if you can.
So like people always ask, does it hurt? Well, the needle going in, you really don't feel it all because it is extremely tiny. Yeah. It's like The needle that you have to get in your arm to get your blood drawn, this is 1/16 of that, because we don't have to have any room for any fluid. So it's teeny, teeny, teeny.
I was gonna say, like, this is smaller than a shot needle.
Yeah,
Even,
way,
like,
way,
super,
way.
super small.
Okay, so I'm going to, what?
Do you want to come around? Okay.
I'm going to feel the knot in her shoulder, and Debbie says, like, this is an area that's bothering you, right, Debbie? Mm-hmm. Okay, so I'm going to go right here, and I'm say, this is exactly where I'm going to put the needle. And Debbie, did you feel that go in at all? No. Okay, so now I'm going to kind of go in, and I say we can kind of clean out this whole muscle. So I feel like most of her tightness is here. So I'm going to kind of angle up. No, and there. So I don't know, you probably can't see that, but on my fingers under here, I'm feeling the twitching. Debbie, are you feeling that? Let me know if you are doing okay. Oh, there you go.
There you
I don't know if
go.
you guys can see that. So her whole mid to upper trap is twitching. And every time that twitches, that means that muscle is relaxing, which is exactly what we want. So I've gotten some out of there. I'm going to come out, put a little pressure, and we're going to do one more. So teeny, teeny, teeny drop of blood. Debbie, so can you tell them, well, not a good position to have you tell them, but what you might feel when we're releasing this muscle is if you have headaches that go up around to your eye, you might actually feel that while you're being treated, which is actually an awesome thing.
I can attest to that.
Yeah, that means that we're getting a muscle that's your trouble muscle for migraines and cluster headaches, all those things. Do one more here just to see if we can get a good one on camera. And she's doing great. Debbie, are you okay? Yeah. So see, she's just kind of hanging out. And again, it's all twitching in the front, so I can feel it on my front fingers twitching, but you can't so much see it on the camera. Okay, so we come out, see, not a drop of blood with that one. That's better to look at. Okay. So after we do that, then if she was a patient, a true client, I would do some deep blue on there. We love essential oils. It works so great after getting work like this done or like after a hard massage. And that's pretty much what it feels like. Like after you get dry needled, you feel like you have more range of motion. That tension, that constant tightness is resolved. You have soreness, like you might feel a little bit bruised or like you had a really hard workout. But compared to the pain that you've been having before, it's like nothing. And then I show you exercises to do, stretches to do, drink water. You can do, again, any topical things that you need to do, ice it if you need to. And then we come in for your next session, see how you do. We can keep tweaking things out if there's upper muscle knots, or like I said, we go along with the program. So,
are there like restrictions like afterwards, like you take so much time off before you go back to your normal activity, or can you just resume right away?
You can resume. There was another study done with dry needling with high college and professional athletes that they would get needled like a half an hour before a volleyball match and their performance was better. They didn't have any limitations. So it depends. If you are used to, it's just like anything. If you've been doing it a long time, if it's part of your normal workout that you've been doing, it's usually fine. Some people feel good that then they decide to do something they're not used to, or like do painting or like other crazy things that they haven't done forever, then you're going to be sore. But really there's not that much for restrictions afterwards, which is also a plus. Like you could go running, you could go lift weights, so that's great.
Awesome.
You could go to burn boot camp.
Yes.
It would all be fine.
Yes.
Drop us if you guys have any questions, like if you're watching replay now, Summer's watching, and Jenny, if you have questions, go ahead and leave them in the comments. Or if we don't get them now, feel free to do it on the replay, and I will answer any questions that we have. You can ask about Burn Boot Camp, or you can ask about the dry needling. Anything and everything is welcome. And be sure you like it or give us an angry mad face. If you have any of those symptoms we've talked about. Did we forget something? Anyone?
West Des Moines.
I was going to say, just the fact that you're moving closer.
Yes,
awesome.
We'll be closer to you guys in Clive. So we are opening a second location. We're in Beaverdale now. And we will be opening our second West Des Moines location by March 1st, I hope, at the latest. So it's amazing. We're going to be at 50th and 235. So if you know where Bradley's and Grumpy Goat are, we're on the back side of that building by Salon Tex, where I get my hair done. So we're going to be super close. It'll just be easy to zip out there. That's awesome. Make sure you tag all of your friends that can come to West Des Moines easily and come see us.
Absolutely.
Yay.
This is super helpful.
That's great.
You hear about it, but until you actually see it, you're like, oh, that's really not that bad.
Right, yeah, it's no big deal. And it's quick. It's just a quick little treatment. It's a whole 5 to 10 seconds and it's done.
Yeah, awesome. Okay. All right, thanks.
Thanks for watching.
Bye.
Happy day.
Happy Thursday, Friday's Eve.
We did it.
Okay, so make sure